Okay, welcome back everyone. The topic of today's discussion will be how to effectively use video lectures. Now, this being an era of app-based teaching, there is app for every single medical subjects, marrow, prep ladder, speed. There are so many apps, and it is moving from a classroom-based teaching into an app-based teaching. So, app-based teaching has got so many advantages, but one disadvantage is that there's a huge number of videos and it's very difficult to listen to them in a non-class atmosphere. When you come back and sit in a room, or when you try to listen it in some other place, you can't put like 7 to 8 hours, you cannot put into that continuous effort. Is very difficult. And we try to, the problem with this video based lecture is that there are sort of 100 to 200 videos available in most of the subjects, and when we just look into the 100 videos, we tend to be afraid like this is so voluminous and each video is 70 minutes, 80 minutes. So it is practically impossible to complete them in a quick and effective way. So this video is basically to make the video lectures more effectively. I mean, how can use that video lectures effectively and crisply will be the topic of our discussion. So what is the goal of seeing a video? It's basically two things. First thing is to understand the topic. You have to understand the topic, and this is the most important goal. If this goal is not reached, there is no point in seeing the video. After reaching the first point, the second point is to have a crisp, condensed material for revision. That is the notes. The notes should be crisp, condensed, and contain all the important points, and it should be used for revision. This is the two goals for seeing a video lecture. First thing, how you can understand the topic better from a video lecture. The common mistake which people used to make is that just they put on the video and start writing every single point what the faculty says. That is not very effective, because at one point we will be bored. I mean, first it will be very tedious. You know, every lecture for 90 minutes we will be bored with writing, and we will try to stop it at one point. So before going on to making notes from a topic, first thing is that start to make questions of the topic. See, every topic may have some bookmarks, like or the key points that will be discussed in that topic. First, try to make those bookmarks into questions. So, for example, if you take an SLE, it will have questions like what are the key features of SLE, what are the antibodies seen in SLE, what are the clinical features of SLE, what is the investigations that is done, what is the treatment. You can just try to make them as a question. And after you make that question, you should try to answer them. You should try to answer them in your brain. What if a patient with an SLE comes to my OPD? What are the clinical features I will in? What are the investigations which I will write? What are the tablets which I will write for treatment? All this you should have. You should spend some 5 to 10 minutes in thinking in your mind. This will prime your mind to be actively engaged in the video. Now, after you make these questions, you think of that video lecture as some friend. Some of the intelligent batchmates, someone who knows, who teaches well. You think of him as that person, and that guy, his job is to just tell you the answers. You will throw him questions and he will throw you answers. Think of the video lecture that way, and then you can just start playing the video. And it is important that you start practicing watching the video in 2x. This is because this will take this will save a lot of time, and with practice, this is not a difficult thing to do. Few of my friends who say that I can't do 2x, I don't understand anything. But when you keep hearing, you try to do for 5 videos. I'm pretty sure the 6th video, you will be used to that speed and you can't come back to 1. So the major mistake we all make is that when we first listen to a video, we are focused on notes making. We are focused upon revising effectively rather than understanding the topic first. So when you first see the video, your goal should be only one thing, that is to understand the topic. Don't worry about the MCQs, don't worry about the exams, don't worry about taking notes, nothing. Just understand the topic. I mean, how do you know that? Try to answer the questions. You just pause the video for somewhere in between and try to answer what are the questions before. Just try to recollect, okay, what are the causes? Okay, this is the causes. What are the antibodies seen? These are the antibodies seen. Okay, what is the clinical features? Hot. These are the findings seen. And then again, pause in between somewhere. Try to recollect and then go ahead. And once you are done with the video, whatever the area when you are not able to explain to someone or not able to recall, go back and listen to that point alone, not the entire video. That part alone you can use it for revising. So after watching the video once, you would have some idea, some good picture of that topic in your mind. Now the second part, notes making. So why you should have notes? It should solve three reasons. First is that it should be simple, concise, and all key points, all the important points of that particular topic in a condensed matter. You should have that material for revision. And the second thing is that you should only use that should be the only source of your preparation. And third one, you should be able to add content into it in later time. You should not just keep it to 2 pages. You should have some extra pages so that you can add content into it later. So note should face these three problems. It should be condensed, it should be a single source, it should be you should be able to add content into it. Second best thing I suggest you is that use the notes that is readily available rather than making your own notes. See, when I was preparing, I felt that preparing your own handwritten note is the best thing you can do. It is true partially, but thing is that amount of time you invest in writing your notes is not effective, because someone else has already put that effort for you. He has made that notes and it is of good quality. Obviously the notes available today are of very good quality, so they have already made you the notes, and your job is not writing out what the teacher says. That is not your job. Your job is to understand them and to have this material for revising later. So you use a pre-made notes and make some provisions so that you can add some content into it. When you use digital notes, it is very easy adding contents, or whatever source you're using, use material so that you can add content later into it, and use pictographic memory and memorize it with understanding. When you start memorizing the notes with an understanding of the topic, it stays and it sticks very easily. So this way you would have both understood the topic and you would be having a condensed material and that sticks in your brain. Now your job is to revise it frequently. Whenever you do an MCQ later, when you make a mistake in that MCQ, come back to the source material and try to read your condensed notes and try to understand it. If you are not able to understand it, go to that part of the video lecture and play it in 2x and try to understand it. So the game is basically about understanding and a little about having a condensed material and revising it thoroughly. So this is the 2 parts of the game: understanding the topic and having a condensed source and revising it multiple times. When you are able to take these 2 things, I think the job is done. So if you like this video, I would like you to subscribe to my channel, like the video, share it with your friends, and whatever you feel about this video, just put it in the comment section. And if you have any other doubts about NEET UG preparation or PG preparation or super speciality, you can definitely put it in the comments.